I've been writing for maybe 25, 30 years, yeah. That's been my primary cardio ever since, which is why it caught me completely by surprise.
It was this advanced MRI that Dr. Timothy Albert used at Salinas Valley Memorial's Cardiovascular Diagnostic Center in Ryan Ranch to detect Lou Medeiros' heart disease.
I got to know Lou because he had volunteered for actually a heart MRI study. And one of the initial things I saw is he had some thickening of a part of his heart that was a little unusual. Called him up that night and I said, you know what, this is actually a little worrisome that there's some real heart disease going on here.
A shocking discovery, because there were no symptoms that indicated Lou had severe blockage in his arteries.
I was in shape, I worked out, I ate right, I thought. For them to come back and say, well, there's a problem. For me?
Well, it's more common than we think, and it's really untreated heart disease that leads to all the problems that we hear about. When we have a good handle of it, know what we're dealing with, we have a very good success rate of stopping the process, and in some cases even reversing the process.
It was not a difficult situation to go through. The scanning just takes maybe a half an hour for the whole thing. You know, there's no pain, no discomfort. It's a great facility. It's all state-of-the-art. It's obvious it's state-of-the-art.
After Lou's diagnosis of heart disease, doctors put in a stint at Salinas Valley Memorial's cath lab, and Lou recovered in record time.
30 days after my procedure, I was back on the bicycle. Felt great to be back on, but I was cautious. And it's amazing to think about what could have happened had I not had the intervention. Because with a 90% blockage, you know, I suspect that I could have gone out for a bike ride and not come back.
And I always try to reassure my patients that the day we diagnose it, we're better off than we were the day before. It's because now we know we can do something about it. I want to catch someone 5 years, 10 years before they have a presentation of heart disease, because then we can do something about it so they never need to go on and have a procedure to open up that blood vessel, or worse yet, have a heart attack. So this new technologies allow us to kind of shift the time a little bit and intervene earlier. And this really is the prime example of prevention.
And what this means for Lou is a healthier life. A life more promising than ever before.
It's changed my life and probably allowed me to live a normal life that I may not have been able to do.